delivery in low to middle income countries and even in high income countries. The VBAC rates vary from different studies, and in one research study, it showed a high successful VBAC rate of 73% with less complications and much faster recovery rate compared to women undergoing cesarean section. Vicente Sotto Memorial Medical Center is an end-referring hospital that caters high-risk pregnancies from Cebu province. And as such, a bulk of these high-risk patients are often seen with significant number already in imminent delivery, and with the ideal double setup for VBAC is not really available. Thus, maternal and fetal outcomes delivered under such circumstances were studied. In this slide, we have the conceptual framework of the study. The statement of the problem is, what are the maternal and fetal outcomes of patients who underwent vaginal birth after cesarean delivery in Vicente Sotto Memorial Medical Center from January 2015 to December 2019? For the methodology, the study design is a descriptive retrospective study design focusing on patient record review in the medical records section. The population of the study comprised of patients who underwent vaginal birth after cesarean delivery in Vicente Sotto, covering this period. And these are my inclusion and exclusion criteria. After technical and ethical approval were obtained, medical charts of 280 women who underwent VBAC during the period were obtained from the records section using random sampling method. And then every fifth patient from the list was selected for the study. For the results of the study, it was found majority of the patients, or 75.4%, were in the 19 to 34 years of age. In a study done by Wu, the investigators highlighted that VBAC is more likely successful among women who are in the younger age, and an increase in the failure rate would be more likely encountered among women over 35 years of age. More than half of the patients were single, and majority, or 42.5%, were from Cebu province. Majority of the patients were multigravid at 89.6% and multiparous at 91.4%. In this study, majority of the patients who had VBAC had 4 to 7 prenatal visits, either at the local health center or with their obstetricians. It is also noteworthy to mention that there are still about 2.5% of patients who did not have prenatal care. WHO defines adequate prenatal care as prenatal visits of 8 or more. Since these patients are considered high-risk patients, the need for adequate prenatal care cannot be overemphasized. More than half of the patients, or 55%, were term at 37 to 39 weeks of gestation, with majority of the neonates, the estimated fetal weight were between 2,600 to 3,500 grams. Nearly 95% of the patients had more than 18 months interval since the last cesarean section, with fetal malpresentation as the most common indication for cesarean section, which is 27.1%. A retrospective study by Stamilio shows that long interpregnancy interval of 18 months or more is not associated with an increase in major maternal morbidity. In this study, it was further noted that patients who had VBAC, regardless of the setting of delivery, had no significant number of adverse maternal outcome, and only a small portion, or 6.4% of these patients, had postpartum hemorrhage. There were no cases of uterine rupture, infection, or death, and all these patients were successfully discharged. Most patients in the study delivered via emergency VBAC while waiting in line for cesarean section. And this increase in the number is related to our institutions unable to provide a double setup, and we have a long waiting line for cesarean section. Majority of these patients are already in active labor upon admission in our institution. With regard to the neonatal outcome, favorable data were obtained. And in this investigation, the highest number of neonates had excellent initial and final APGAR score, regardless of the setting of VBAC, and the actual neonatal birth weight and age were found within the acceptable limits as well. In conclusion, patients who had vaginal birth after cesarean delivery, regardless of the setting of delivery, yielded favorable maternal and fetal outcomes. And these are my recommendations. Thank you.
Dr. Baluardo, for that very comprehensive presentation of your research paper entitled A 5-Year Retrospective Study of Maternal and Fetal Outcomes of Patients with Vaginal Birth after Cesarean Delivery at the Vicente Sotto Memorial Medical Center. So Vicente Sotto is one of the identified apex hospitals in Visayas, no, and soon will provide a multi-specialty services, I think including the maternal services. So that's a good paper, Dr. Baluart. So for our next presenter is let us call on Dr. Osorio of Region 1 Medical Center. You have the floor, Dr. Osorio.
The novel coronavirus has taken its crown to the global limelight, being the pandemic of the decade. Initially known in Wuhan, China, it has caused an influenza-like illness to a number of individuals, then clustering to hundreds to thousands, affecting the whole world. Good afternoon, dear panelists, members of the Research Performance Management, attendees, ladies and gentlemen. I am here to present a research on epidemiological and clinical profile of COVID-19 suspects seen at tertiary outpatient department, a retrospective study. I am Dr. Abigail Angeline Osorio, a Level 3 resident physician of the Department of Family and Community Medicine of the Region 1 Medical Center, Dagupan City, Pangasinan. During the extreme enhanced community quarantine from March to May 2020, the province of Pangasinan recorded 39 confirmed cases. 27 have recovered and 9 died. The city of Dagupan has recorded the most number of cases, followed by Urdaneta City and municipality of Bayambang. At that time, there were 387 persons under investigation and 98,380 total number of persons under monitoring. The Region 1 Medical Center, a DOH retained tertiary hospital of the province, caters the COVID-19 cases and provides necessary healthcare services. Other COVID-19 confirmed cases were confined and treated in the district and provincial hospitals. In Northern Luzon, the only identified and accredited testing center at that time is the Baguio General Hospital and Medical Center, where the samples from the province and the Region 1 Medical Center are being sent. The significance of the study: the COVID-19 has caused a dramatic change to the world and its people. Understanding the disease itself and its impact, not only to the health of infected individuals, but also to the overall effect of the pandemic, are essential to cope up with the crisis. Documenting the cases seen in the outpatient department of this institution is deemed necessary for monitoring and surveillance of COVID-19. Results of the study may be used for future strategic management and of controlling the outbreak in the hospital, the city of Dagupan, and the province of Pangasinan. For the general objective is to describe the socio-demographic, epidemiological, and clinical findings of suspected COVID-19 patients seen at the outpatient department screening triage area. For the methodology, the research is a retrospective descriptive study of COVID-19 suspects. It was conducted at the outpatient department of this institution. All patients were screened using the Department of Health interim guidelines, who are tagged as COVID-19 suspect, assessed from February 11 to June 15 of 2020. Suspects referred and tagged by other health institutions and requiring emergent care were excluded from the study. For the data collection, chart and logbook review of patients, of COVID suspects, and or person under investigation were reviewed. Socio-demographic data such as age, sex, occupation, the epidemiological information including the history of travel or exposure to probable or confirmed COVID-19 patients, as well as the clinical characteristics, signs and symptoms, presence of comorbidities of these patients, and the laboratory testing as well as the disposition were recorded and analyzed. For the statistical data analysis, categorical variables were measured as frequencies and percentages. The data was analyzed using Microsoft Excel 2010. The period of the study was from February 11 to June 15, 2020, when the province of Pangasinan and the most areas in Luzon were placed under enhanced community quarantine. Figure 1 on your left illustrates the number of COVID suspects within the time frame. 78 COVID-19 suspects were tagged, with the most number of cases, 31, recorded on the month of April. The figure 2 on your right is the age-sex distribution of COVID-19 suspects. About half of the cases seen, 42, were male and majority were aged 19 to 59, with a mean age of 39. 29% were non-health frontliners who provide service for basic needs during lockdown measures, and 28 were health workers, mostly nurses, 9, and physicians, 8, who had direct exposure to COVID-19 patients. The remaining 28% were unemployed and retirees. Clients who had exposure to COVID-19 patients were 37%. On travel history, 63% came from areas with high cases of COVID-19 or areas declared with local transmission. 5 suspects had travel history from abroad, 2 from Taiwan, 1 from Hong Kong, 1 from Japan, and 1 from Israel. And the rest were from the National Capital Region, the area of highest number of COVID-19 confirmed cases. Clinical characteristics of these suspected cases were as follows. 76% reported no known comorbidities, and the remaining 24% were high risk due to existing illnesses. Hypertension was the most prevalent disease, about 10%, followed by heart diseases, 4%. Other comorbidities include diabetes mellitus type 2, respiratory conditions like bronchial asthma and chronic obstructive pulmonary disease, cancer, and pregnancy. Most common symptoms noted at the time of onset of illness were 1, cough, 74%, fever, 44%, and 3, sore throat, 36%. Infrequent symptoms such as chest pain, chills, watery eyes were also reported. Majority had normal vital signs at the time of examination. 46% had heart rates greater than 100 beats per minute. 7 cases had tachypnea. 2 were febrile at the time of examination, and 1 had oxygen saturation less than 95% on room air. 44 out of 78 COVID-19 suspects were tested using the RT-PCR for SARS-CoV-2. Only 17 patients were admitted at the isolation ward of the hospital. The other cases were advised to do strict home quarantine and were referred to Hospital Epidemiology Center for surveillance and coordination to their respective municipal and city health offices for monitoring and follow-up. At the end of the first quarter of year 2020, the World Health Organization, and as affirmed by the Department of Health, has declared the COVID-19 disease as a high-risk health event locally and globally. Surveillance on the possible spread of the disease in the country was enforced to all entry and exit points, as well as all concerned agencies were forewarned and required to prepare, to respond, and to impose necessary measures to prevent transmission and to contain the disease. Enhanced community quarantine was imposed over entire Luzon from March 17, 2020, and the province of Pangasinan was placed under general community quarantine thereafter until June 15, 2020. The outpatient department screening for suspected COVID-19 cases was implemented by the institution last February 2020, which is manned by the Department of Family and Community Medicine, resident physicians, consultants, and the outpatient department nurses. Any person identified as a suspect was withheld at the screening area, and further evaluation, history taking, and physical examination, as well as management, was done by the physicians on duty. The first ever PUI or COVID-19 suspect identified in Region 1 Medical Center in the province of Pangasinan was a 28-year-old female sales agent from Lingayen who had travel history from Taiwan. She presented with cough and colds accompanied by watery eyes, no fever, sore throat, body weakness, nor diarrhea. She reported no known comorbidities. At the time of initial examination, patient had normal heart and respiratory rates, febrile, with good oxygen saturation of 98%. Patient was immediately admitted at the isolation area and treated accordingly. Salva and colleagues studied the epidemiological and clinical characteristics of patients suspected with COVID-19 admitted from San Lazaro Hospital from January 25 to March 29, 2020. Among 100 suspects, most were aged over 18 and Filipino, over half were male. 47% had travel history and around one-third suspected cases had at least one underlying comorbidity and hypertension was prevalent. Cough was also the predominant symptom, followed by coryza and fever, then sore throat and dyspnea. 42 patients were laboratory confirmed COVID-19. The findings of this study were comparable to that of the San Lazaro Hospital. Adult Filipinos were generally affected since this age group were the only allowed to move around during the community quarantine. Thus, possibility of exposure is highly probable. Due to the increasing numbers of COVID-19 in the country, global shortage of testing kits, and limitation in local capacity for testing, the Department of Health issued guidelines on testing with prioritization among subgroups of at-risk populations. Consequently, not all patients suspected with COVID-19 seen at the R1MC OPD were tested. Nevertheless, they were assessed carefully on the risk of contracting the disease and overall health status. At the time of the study, sample specimens collected from the suspected cases were sent to Research Institute for Tropical Medicine in the Baguio General Hospital and Medical Center. It was only last June 9, 2020 that the Region 1 Medical Center Molecular Laboratory was licensed and authorized by the Department of Health to operate the conduct of COVID-19 rapid PCR testing using the Gene Expert technology. For the conclusion, a total of 78 patients were seen as COVID-19 suspects. Of these, over half were males and aged 19 and above. Two-thirds of them had travel history and one-third of the suspects had exposure to COVID-19 cases. Mostly presented with cough, fever, sore throat, and had normal vital signs. Only a few had existing comorbidities and hypertension was prevalent. More than half of the suspects were tested and only 17 were admitted at the isolation ward of this institution. Further recommendations, follow-up studies should be done to evaluate outcomes of these COVID-19 suspects. Further researches on the profiling of COVID-19 confirmed patients confined in this institution can be facilitated, including correlational studies on the clinical epidemiological data and occurrence of COVID-19. So these are my references. With that, I now end my presentation and thank you very much for your kind attention.
So much, Dr. Osorio, for that very timely research paper on epidemiological and clinical profile of COVID-19 suspects at the Tertiary Outpatient Department retrospective study. So now let us listen to another interesting topic, which will be delivered by Dr. Marian De Jesus from Dr. Jose N. Rodriguez Memorial Hospital and Sanitarium. You have the floor, Dr. De Jesus.
Good afternoon. I will be presenting my research entitled The Clinical Profile, Birth Outcomes, and Postpartum Contraceptive Uptake of Teenage Pregnancies at the Dr. Jose N. Rodriguez Memorial Hospital and Sanitarium from January 1, 2018 to March 15, 2020. One of the prevalent dilemma today is about teenage pregnancy. In the most recent analysis conducted by WHO, adolescent mothers aged 10 to 19 years old had higher risk in developing maternal and fetal complication. We have the Teen Parents Clinic that has a designated room in the hospital. The services are offered by trained healthcare professionals consisting of doctors, nurses, and midwives who provide pregnancy-related services such as immunization, antenatal care, and delivery within the hospital. The importance of prenatal check-up, newborn care, postpartum care, exclusive breastfeeding, and family planning options are discussed with the pregnant adolescent. Adolescent pregnancy exposes young mothers and their children. This study aims to demonstrate that Teen Parents Clinic helps in improving pregnancy outcome, lessens pregnancy complication, encourage the teen mom to choose a method concordant with her goals and preferences, and hopefully increase the rate of acceptance of contraceptive use postpartum. My objective is to describe the clinical profile, birth outcomes, and postpartum contraceptive uptake of teenage pregnancies among patients registered in Teen Parent Clinic versus unregistered patient at the institution. For my specific objective are as follow: to describe the teenage mothers in terms of age, gravity, parity, registered or unregistered. Next, to determine and compare teenage mothers who are enrolled in the Teen Parent Clinic versus those who are walk-in teenage pregnant mother in terms of age of gestation, mode of delivery, birth outcomes, and pregnancy complication. Next, to determine the postpartum contraceptive uptake in terms of different contraceptive methods such as barrier, contraceptive pills, DMPA, PSI, and IUD. Then, to compare the acceptance rate of contraceptive usage postpartum of adolescent patients enrolled in the Teen Parents Clinic against unregistered patients. And lastly, to be able to come up with recommendations for the Teen Parents Clinic based on the outcome of the study. The Department of Obstetrics and Gynecology at the Dr. Jose N. Rodriguez Memorial Hospital and Sanitarium established the Teen Parents Clinic in coordination with the Service Delivery Network and Family Planning Unit on October 17 and started its operation at the outpatient department subsequently. The Teen Parents Clinic, also known as TPC, is an adolescent-friendly clinic serving as end referral for pregnant adolescent patients. This is a retrospective cross-sectional study of all adolescent mothers who gave birth at the institution. My inclusion criteria are all those adolescent mothers from 13 to 19 years old, regardless whether they are registered or walk-in patients that were admitted and delivered in the institution. My exclusion criteria involves all adolescent mothers who was not delivered at the time of the study, those who delivered at other institutions, and those who were lost to follow up. For my results and discussion, we analyzed a total of 1,780 adolescent mothers, of whom 763 or 43% were enrolled in the TPC. The total of 1,780 comprised of 16% of total deliveries. The increase in number of pregnant adolescents is alarming in its own, since teenage pregnancy is considered high risk and a major health concern. Comparing the age group across the years, the proportion of 15 to 17 years old had been increasing from 2018 to 2020. On absolute counts, there was a marked decrease in teenage birth in 2020 compared to the previous years due to the start of the pandemic. While majority, which is 82.87%, were primary gravids, there were 305 mothers, which is 17%, who were multigravid. The non-TPC group had a higher proportion of multigravid, and this signifies that early childbearing in adolescent is at risk for a repeat pregnancy, which increases the risk of preterm, low birth weight, small for gestational age, and infant and early childhood mortality. Overall, teenage mothers delivered term at 85.73%. The two groups were different in terms of preterm delivery, with preterm birth, which is 15.14% in the non-TPC group, was significantly higher compared to the TPC group. The proportions for the different modes of delivery were similar between the TPC and the non-TPC group, wherein majority of teenage pregnant mothers deliver via vaginal delivery. The most common indication for cesarean section for both groups are dystocia, fetal distress, and malpresentation. The adolescent pregnant mother are at risk for dystocia since due to the underdeveloped pelvic bones at delivery, this poses a greater risk for obstructed labor resulting in poor fetal-maternal outcome. Obstructed labor is something that is preventable cause of maternal and perinatal deaths and disabilities. Pelvic immaturity that is associated with young maternal age is a risk factor for fetal malposition. The following comorbidities were reported in the adolescent mothers, such as hypertension, meconium staining, bronchial asthma, anemia, and GDM, wherein preterm birth is the leading cause of complication. Overall, intrauterine fetal demise was reported in 13 mothers, all of whom were in the non-TPC group. For the postpartum contraceptive use of pregnant adolescents, 48.99% of the pregnant adolescent patients were discharged with postpartum contraceptives, with the highest among IUD, followed by DMPA and by Implanon. The patients under the TPC had a significantly higher uptake of contraceptive use. For my conclusion, the Teen Parents Clinic in the hospital is valuable and effective in improving maternal outcomes of teenage mothers. There was a significant decrease in fetal demise and preterm births among teenage mothers, higher UPGAR score, and higher uptake of postpartum contraceptive use under the Teen Parents Clinic compared to those who are not under the program. This signifies that counseling done by each member of the Teen Parents Core team is successful. The TPC and the hospital is a strategy on improving maternal and neonatal outcome, as well as reducing maternal and neonatal mortality, which is an important health indicator in the healthcare delivery system in the country. For my recommendation, it is recommended the Teen Parents Clinic program be institutionalized in every hospital. This is to strengthen programs to prevent unwanted pregnancies, such as preventing early miscarriage, improving knowledge, and promote use of contraceptive methods so that adolescent pregnancy can be prevented by providing regular information campaign. Antenatal care must be strengthened and reduction in the incidence of unwanted teenage pregnancy and repeat pregnancy rate by improving access to effective health education and contraceptive services. In the future research, it is recommended to study on the factors of poor prenatal care that cause serious complication on the mother and the infant, with specific neonatal outcomes, long-term effect on the health and well-being of adolescent mother. Also, it is recommended to study if repeat pregnancy rate is reduced after establishment of the Teen Parent Clinic by interviews and surveys. And since we are in the time of the pandemic, COVID in teenage pregnancy is also suggested.
Dr. Baluardo, Dr. Osorio, and Dr. De Jesus, what are the challenges that you encountered during the conduct of your research papers, especially these times of pandemic? Here first from Dr. Baluardo muna siguro. So what are the challenges that have you encountered during the conduct of your research paper, especially this pandemic?
Thank you, Doc. For my research, Doc, the challenges that I've encountered during my conduct of the study probably is the collection of the data in the medical records, because they have already limited since the pandemic started. The medical records section in our institution have already limited their the number of people who will go inside and or get the data, and also I have to wait for because there is because we are provided with computers in order for us to search the patient's charts, and we have there are a lot of residents also from other departments are also using the computers, and that's why for my population, I just limited it to 280 patients, population of 280 from a population of 1,024. And also the challenge also that I encountered is that since my research is started from is a 5-year study from 2015 to 2019, I encountered I've encountered I cannot access other patients' charts because they are not yet scanned. So that's why I cannot, as much as I would like to get all the patients or the population of 1024, I cannot get all of them since not all patients' charts are yet scanned, Doc.
Dr. Balwado, for that answer. Yeah, since part of the policies maybe of the Department of Health, we can consider na full electronic medical records na talaga, no, so that we can actually access the record of patients for research, especially this time of pandemic, that we cannot go to the records area and then gather some data, and then you will be exposed to some people also inside the medical records office. Thank you po. Doc, I think the question of Sir Jernan Alejandro is also related to your research paper. Since, may I read po the chat? Since it's a 5-year retrospective study, so he's asking what is the impact and implication of your study?
I made initially, Doc, I initially planned to do a 3-year retrospective study only, but my co-author suggested that it should be 5-year retrospective study since we only have there were some years in our institution in our institution that there have been decreasing number of patients who have delivered VBAC. So when I decided to do the 5-year retrospective, I noted that there were from 2015 to 2017, I noted that our department, the Department of Obstetrics and Gynecology, were actually practicing vaginal birth after cesarean delivery, and our patients that time were not that very, not a lot. And starting 2018 to 2019, I started to note that there have been an increase in the patients who delivered VBAC, and also our cesarean CS rate also increased, Doc. And this is also implicated also in today's pandemic, since before in our institution, we usually cater a lot of patients, but now we cannot cater everyone, only those patients who are high risk, especially when they are all referred from other institutions from the province of Cebu. And with this, Doc, a lot of also the turnaround time is also affected, since we need to do UV light of the operating room, and our staff is also decreased. It's also limited because of some are had been quarantined, and also our anesthesiologists. So with this, Doc, noting that my study resulted to a very good favorable outcome of mothers who delivered by VBAC, it is noteworthy to say that we can actually perform VBAC and not be afraid to have the complications, since my study results to have low or no complications, Doc. Only 6.4% of patients had postpartum hemorrhage.
Dr. Balwardo, and I'm also glad to hear that Vicente Sotto Memorial Medical Center obstetrics and gynecology department is doing well, no, in their VBAC in the hospital. So thank you po, Doc. For our second presenter, since wala pa pong questions, could you answer the first question a while ago raised? So what are the challenges that you encountered during the conduct of your research paper? You have the floor, Dr. Osorio.
Yes, sir. So what are the challenges? Since COVID-19 is new for everyone else, and it poses a public threat, and the conduct of this study is really challenging for me, being one of the frontliners who caters the COVID-19 suspects first in our institution, especially in the outpatient department. And then the data collection and writing the paper itself for me to come up with the proper the results that I could endorse to our institution regarding our data. I think that's the challenge because we need to set the initial results and analysis of the study so that we can push through to the other strategic management or policies that we could eventually improve for the management of COVID-19, not only the suspects, but also for the confirmed cases in our institution. Thank you, sir.
Dr. Osorio. And may we call Dr. Jesus to respond po.
Good afternoon po. I think I was thinking actually if my challenge was on the data collection, but since my research is more on a retrospective study, I think I didn't have a problem in the collection because first of all, aside from the medical records, we have a medics in the hospital wherein this is an application wherein all the data of our patients are in one system. And aside from the records and the medics, we also have actually in our teen parents clinic, we have the staff wherein they keep track and record of all our patients. So we have the log books and the file. And aside from that, I also coordinated in the family planning unit wherein they are also good in keeping track of our patients. I think one of the challenges is because when the coverage of my research is from January 1 to March 15, 2020. It was in March 15, it was in March 2020 wherein our hospital was converted to a COVID facility. So my data, I'm not sure from that time, we already saw limited number of cases because of our outpatient department, which already closed. So I think because of the limited time, I have to cut my study to March 2020, wherein we are catering the teen parent adolescents. I wanted to do more on my research, such as not only getting the demographic profile of the mother or the outcome. It just so happened that because the topic is very broad, like I wanted to specify the specific outcomes if the baby are more prone to distress or encephalopathy, but because of I think the data from the pedia also are not complete. Hence, I think that was my challenge. So everything I just put in my recommendation, and I really wanted to prove also that having the teen parents clinic will reduce the repeat pregnancy of teenage mothers.
Dr. Jesus, for that answer. Dr. Jesus, may I have a relative to your last statement, especially in your recommendations? Yesterday kasi I've been also chair session on hospital statistics, and one of the researcher there presented her paper on the association of advanced maternal age with adverse pregnancy outcome in a tertiary government hospital. Fortunately, when I checked the hospital, it's the same with you, no, sa Dr. Jose Rodriguez. It's been authored by Dr. Marian Capada. So same institutions. May I ask if is there a possibility to compare the kasi yung isang study kasi talking about advanced maternal age no with adverse pregnancy. Tapos sa inyo naman yung teenage no. So pang maganda siguro ipag let us compare siguro kasi one of her recommendation also to look into the complications as well as outcomes ng advanced maternal age pregnancy. So with you no siguro with teenage pregnancy is there a I hope no maybe it's the suggestions already maybe you could consider to collaborate with each other and then come up with a better paper siguro kung hindi man kayo siguro maybe the junior residents or junior consultants that you could conduct.
Yes po, but actually it is a different paper because we have a different population wherein my research focus on teenage mother, and the paper of advanced maternal age focus on more than 35 years old. And in our hospital, we have this we have the program only for the teen parents clinic, for the teenage mother, and those that are an advanced maternal age.
Sige, maybe we can explore na lang po that idea, Doc, na you could compare no, with your outcomes. So before I'll end this session, I would like to provide some of my synthesis to these research papers. No? So basically, 3 papers presented this afternoon provide us novel idea and new data, no, especially this time of pandemic. And it's provide us way to improve our clinical management of our patients. No? In the first paper authored by Dr. Baluardo, it's talk about the vaginal birth after cesarean delivery. So based on her study, maternal and fetal outcomes were noted with a different demographic profile, clinical, as well as the setting of delivery. Patients who had VBAC were mostly in the 19 to 34 years old with single marital status. Usually it came from Cebu province, multiparous, and had 4 to 7 prenatal visits. And the age of gestation is within 37 to 39 years old. The interpregnancy interval was noted 18 months, no, with common indication for previous CS. It is also interesting to note that 6.4% of these women have postpartum hemorrhage, and it's very low no, as compared to the previous studies conducted. No fetal complications were also noted, and I hope no, with these research findings, some of the institutions can also learn from the Vicente Sotto Memorial Medical Center, and they can open the door for more trainings for our obstetrics and gynecologists, no, in terms of improving the quality of hospital services for our maternal care. For the second paper, authored by Dr. Osorio and Dr. Renato Espinoza, on the epidemiological and clinical profile of COVID-19 suspects at tertiary outpatient department. So it is a retrospective study conducted in one of the DOH hospitals in the north, no, the Region 1 Medical Center. All we know that suspects cases of COVID has been increasing, no, since in the initial phase of the pandemic because we have a lack of laboratories in the north, no, since kailangan mga munang i-identify na through that RT-PCR before we can consider that the patient in the COVID-19 positive. So these findings provide us additional information about suspects. No, while waiting for results from the RT-PCR, it provides us information that based on the findings of the study, 42 were males out of the 78. No, 2 are adolescents, 66 were aged 19 to 59 years old, and there were also 10 suspects elderly. 2/3 had traveled history, and that's also very important to note, no? Lalo na yung mga kababayan natin is asking why they are always DOH as well as the contact tracing form, no? Bakit nagtatanong parati ng travel history? This is a good information because based on the study, 2/3 na ay may travel history. Then they are already suspect with COVID. No? 37% of the patient had exposure to COVID-19 confirmed cases. This also shows that this COVID-19 has a high proportion in terms of virulence. No? Mostly presented with cough, so 74%, sore throat, as well as fever. 24% had existing comorbidities, including hypertension of 10%, was also prevalent. 46% had heart rates greater than 100 beats per minute, with 7 cases had tachypnea, as well as 2 were afebrile at the time of examination. So this paper would also provide us idea that we must improve our laboratories so that these suspects will not eventually mix with other COVID-19 patients. And of course, to limit also the rate of infection. So that's a good paper also and very timely. So for our third paper, it talks about the teenage pregnancy. No? As mentioned, even in the research papers conducted by the National Research Council of the Philippines, it provides us information that during pandemic, talagang tumaas yung cases ng ating mga teenage pregnancies. So in this data, it also confirmed that even in the pre-pandemic, there's already an increasing number of adolescent mothers. No? In fact, 16% of the total deliveries in the hospital, in Dr. Jose and Rodriguez, are comprised of teenage pregnant mothers. It's good that the Dr. Jose Rodriguez has a teen parents clinic. No? It's a very good intervention wherein it would reduce the risk of our teenage mothers of developing a complications. So as here in the paper presented, the most common indications for CES for both groups were dystocia and non-reassuring fetal rate, heart rate, and malpresentation. There were also comorbidities identified for adolescent mothers, which includes, nakakapagtaka, no? Even hypertension, maraming hypertensive na mga teenage mothers, meconium staining, bronchial asthma, anemia, and GDM. There were also significant decrease in the preterm delivery and fetal demise, no, among the TPC group in the what we call the teen parents clinic in the hospital. It has a good APGAR, which is significantly higher than that of the non-TPC or the teen parents clinic deliveries. 48.99% of the pregnant adolescent parents were discharged with postpartum contraceptives. So that's also good that we need also to inform our teenage mother also to practice contraceptives, no, so that future complications will be avoided, no? As well as improving the health services of our hospital. So these all papers are basically would contribute to the new body of knowledge and improving our health systems in the near future. So again, congratulations for all of our presenters, as well as all your hospitals, officials, department chairs, research committees, no, for going here, no, and attend as well as participate and present your very good research findings. So congratulations po to all of you, and I hope I can see your paper published also in the journal, and you will be part of the not only in the library but as well as improving the health services po natin. So maraming salamat po sa lahat.